Hi everyone, today's announcement will be on the prevalence of intellectual disabilities, which in this presentation we will call ID, in both the general and athletic population, along with how to recognize, deal with, and treat intellectual disabilities in both of these populations. For those of you in the audience that are unaware, the American Association on Intellectual and Developmental Disabilities defined intellectual disabilities as a disability that originates before the age of 18 and is characterized by significant limitations both in intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. Anxiety and psychosis are the two most common signs and symptoms. However, if yourself or someone you know has become aggressive, self-injurious, tends to scream frequently, has tantrums, maintains destructive and difficult habits, and constantly seeks attention, you or the person you know might have an increased level of psychopathology that has resulted from their intellectual disability. Levels of intellectual disabilities are determined on an intelligence quotient, also known as IQ scale. This scale ranges from mild, moderate, severe, to profound. The average IQ in an individual is 100. If you are an athlete with an ID, don't be alarmed. Healthcare professionals will take the proper steps in ensuring that you receive equal treatment compared to other athletes that do not have an ID and that you are not at a decreased risk of succeeding in your sport. These steps will be discussed in the following slide. Athletes with ID will be given clear and concise instructions, ample enough time to become familiar with their treatment and rehabilitation. The task will be demonstrated by simple one-step instructions, and they will be asked to repeat the instructions back to the healthcare professional to show that they truly and fully understand them. Certain medical concerns have been identified in individuals with intellectual disabilities, such as, but not limited to, seizures, pain insensitivity, excessive medication use, and vision abnormalities. Athletes with intellectual disabilities that have suffered from seizures in the past should undergo a thorough neurological examination prior to participation in their sport. Also, these athletes with intellectual disability and pain insensitivity should be aware of all possible injuries in order to prevent any further injury in the near future. Athletes with intellectual disabilities that are taking medication should ensure that their medications are not under the NCAA banned substance list so that they can continue further participation in their sport. Also, athletes with intellectual disabilities that are experiencing vision abnormalities should undergo a thorough ocular examination before continuing their sport.
Created using Powtoon.